There are different types of infant formulae. The most commonly used is a stage 1 milk, and most of them currently are predominantly whey based. There's 60% whey and 40%. The protein content of the formula is 1.3 to 1.4 grams per 100 ml. Vitamin and iron supplementation in the formula as well. And various other components are added, the long chain polyunsaturated fatty acids, arachidonic acid, DHA supplements. Some milks come with probiotics added to them. Majority of them come with prebiotics added. And recently we have the human milk oligosaccharides which have been added to infant formula to try and replicate it similar to the breast milk. The calorie content of the normal milk is 67 calories per 100 ml. This equates to what is there in the human milk. The hungry baby milk is nothing but a milk where the whey casein ratio is reversed. It has 80% casein. So most of the older formulas about 15 years or so back had this composition. It forms a thicker curd which delays the stomach emptying, and so possibly the baby is less hungry. But remember that the protein is less ideal than the human milk because human milk is whey predominant, and the reason the whey became more in the formulas despite it being more expensive to manufacture is to make it as close to breast milk as possible. So if you are going for the hungry baby milk, you should remember that you're actually choosing an inferior product. The stage 2 milk is generally recommended after 6 months of age. However, please remember that it has casein predominance as the baby can tolerate other products well. Usually weaning has started by this time as well. There's a higher sugar content, and remember that lactose is a more difficult sugar to produce than sucrose because lactose has to be separated from milk, and sucrose is readily available. So the stage 2 milks are having sucrose as a significant component as well, which is not ideal for the developing teeth. So obviously we should keep in mind that the stage 2 milk is for a baby who has weaned reasonably well. So the milk is not the predominant diet at this stage, and it can be continued. The stage 1 milk can be even continued till 1 year of age if you want to keep the advantages.